Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with the Montgomery County Medical Society? Find out more right now. My guest this evening is Dr. Irfana Ali, President of the Montgomery County Medical Society. Irfana, welcome to Housecall.
Dr. Doman, thank you so much for inviting me.
It's our pleasure. So briefly, tell our viewers about your professional training and background.
So my training is in emergency medicine. I went to medical school in Maryland. I grew up actually in Howard County, and then I went to medical school at University of Maryland, and I went up to Massachusetts to do my residency at UMass in emergency medicine, and then stayed up there for a few years, and then came back to Maryland. And when I came back to Maryland, I transitioned out of emergency medicine and started an urgent care center in 2009. And we have two urgent care centers, Fast Track Urgent Care in Kensington and in Colesville.
How is it then with your busy professional schedule, you went on to get involved with the Montgomery County Medical Society?
So, when you are in a private practice rather than a hospital-based practice as I was, when you're on your own, there is a need to connect with other physicians and a lot of support that you need. And I looked for that, and I found it in the Montgomery County Medical Society. And so I joined the society around the same time that I opened our clinic. And it is a wonderful organization that gives you physician support as well as ancillary support. So that's how I got involved with the Montgomery County Medical Society.
Now, our viewers may wonder, what's the difference between the Montgomery County Medical Society and the Maryland State Medical Society, also known as MedCog? Please explain that difference.
So this is something that a lot of people get very confused about, even physicians when they first join, and I have to say that I was one of them. So Montgomery County Medical Society, you can imagine, is like a branch of a larger organization, the Maryland State Medical Society, which is called MedCog.
And what is the relationship of the Maryland State Medical Society to the American Medical Association?
The American Medical Association is more of an umbrella organization, and MedCog, takes information and efforts of their state and helps the American Medical Association with issues that need to be brought up from Maryland.
What do you hope to accomplish as president of the Medical Society this year?
This has been probably this is the second year with COVID-19, and one of the most important things, I guess, that we've noticed is how much of a barrier to care and access to care there is for patients, that I think that we all know when we practice, but it's been brought out because of the pandemic, so that people are much more aware of it. And so my hope is that, to be able to help the society provide more care, for our patients.
Why is it important, do you think, that physicians become members of the medical society?
So, the physicians, when they join the medical society, it basically means that they're quite devoted to their patients and the residents of Montgomery County Medical Society. They've made an extra commitment to our community, an investment in our community. They live and they work in Montgomery County, and they care about individual patients' health and community as a whole. And it also makes us better physicians because we can get a lot of guidance and help from the society in this rapidly evolving pandemic. The society's been able to offer education, CME guidance. So it's a really good thing to be a member of the society, and it's also a way to be able to give back to your patients.
What kind of patient advocacy issues do you think are in front of the medical society during your term this year?
Yeah, so it's interesting. We just had a meeting where we met with some legislators about issues that we do need to raise. One of the issues is providing more access to care by having some parity with Medicaid funding. It allows a lot more physicians to be able to see patients. Um, the second issue is being able to provide primary care physicians an opportunity to serve underserved areas, and finding a way that that can be done, that can provide some help to primary care physicians that want to do that. And then another issue is uh, authorizations. Prior authorizations are difficult for patients, and it's difficult for physicians to be able to get the care for their patients as they want because of these barriers to care. That's
What?
something that we're helping bring up.
Sure. And what about specifically the COVID-19 pandemic? Have there been any interplay between Annapolis and the different component medical societies to improve testing, access to vaccines, et cetera?
For sure. The Montgomery County Medicine website at uh, on their website and also on the state website, CDC website, gives a lot of information on being able to access vaccines, being able to access testing, and it provides physicians also assistance in getting supplies, for PPE, because that has been a really big problem, especially in the beginning of the pandemic when these were in very short supply. So the county organization was able to help, in conjunction with the state medical society.
Now, given your emergency room background, what are you hearing around the county hospital emergency rooms, as well as the medical staffs in the hospital, about having adequate medical staff, physicians and nurses to care for the pandemic patients?
I can give you some personal conversations I've had because I don't do many shifts now at the hospital. But I believe that even in our urgent care, we're having the same problems that the hospitals are having. We have staff that had COVID infections and then they had to stay out of work. And so therefore we are understaffed. And, you know, unlike a hospital that can't really close, we had to close one of our clinics because we just didn't have enough staff. And hospitals are having the same problem. They have huge staffing shortages because of the pandemic and because of employees becoming sick themselves.
Oh my. Uh, what about where we go from here in terms of the pandemic? All these months and now, as you said, a couple of years, there's been this goal to just eliminate the infection. Now we're getting more and more word from the infectious disease global authorities that it may never be eradicated, that it may be something we'll learn to coexist with. What is your sense about that?
I think they're probably correct. I believe it's going to be like influenza. We just have to live with it. It may become seasonal. I've read somewhere that they think that COVID might also be a seasonal virus, but I haven't really, confirmed that. But yeah, I believe that we're going to have to learn to live with COVID-19 in some form. If it's the Omicron variant, then perhaps it's not as bad as living with the Delta variant of COVID-19. I believe that it's going to continue to mutate, and perhaps we can only hope that it mutates into a more benign form. But I really do think that we're going to have to learn to live with it, and you know, um, we'll have to perhaps just be more cautious when we're sick or when we go to the hospital or when we're around sensitive patients or, immunocompromised people, we should always be wearing masks if we're sick. And it may be the case that for several years we wear masks at the hospital, we wear masks at physician offices, and perhaps even in big public places where there might be some transmission of the virus. Um, as you can imagine, during this season, we haven't, during this pandemic, the last couple of years, we've seen very little influenza. We've seen not much other viral infectious disease because we've been very cautious, sanitizing our hands and wearing masks. And I believe if we can continue this practice, if we're sick, then we can assure other people that maybe they won't get sick from us.
You mentioned an interesting point that because of the precautions during the pandemic, there has been a drop in flu incidents. So what would you say to viewers say, well, great, I can skip my annual flu shot?
Oh no, don't skip your annual flu shot. Even though we've seen less influenza, it's still out there, and we have such a um, difficult time with hospital beds and trying to keep hospital beds open. We have so many patients being admitted with COVID-19 that we don't really want to inundate the system more with patients becoming sick with influenza, because influenza also causes serious illness. So we certainly should be encouraging uh, influenza vaccination. The CDC recommends it for anyone age 6 months and above. We certainly should be vaccinating with influenza. We don't want, somebody's actually called it the twindemic, because we are certainly seeing a rise in influenza now as people start taking off their masks. Perhaps it was a little bit before Omicron, where the masks kind of went back on. But yeah, I certainly think that influenza virus is still around, so therefore we should be getting vaccinated and encouraging all of our patients to be vaccinated.
The state of Maryland, compared to most states, has done quite well getting its population vaccinated,
Mhm.
particularly in Montgomery County. And yet, locally and nationally, as you well know, despite excellent global data showing its efficacy and safety, there still are people that are very resistant to getting vaccinated. So here you are, you're president of the Montgomery County Medical Society. What would you like to say to the viewers who have not been vaccinated?
Well, there are a lot of different concerns that patients have when they come to, say, my urgent care and they're not vaccinated and they're getting their weekly test for work. And I ask them, are you still not vaccinated? And they'll say, well, some patients will say, I'm just really scared. I'm scared because somebody I know got really sick from getting the vaccine. So, I tried to allay their fears, tell them that the numbers are in the favor of people not getting very sick with the vaccine, and they really should get vaccinated. There are people that do read information that's misleading, um, that confuses the issue. They believe something that may not be accurate, but that's fed probably by a lot of people around them too that are also feeling the same way. So they're very reluctant and very resistant to hearing about uh, the benefits of the vaccine. So those patients, um, I just wish there was a way that we could provide them information that they could believe in. And the problem is they don't believe in the information that is being provided by the CDC and by this, by the scientific community.
I agree. The messaging has become a problem.
Yeah.
We're going to pause briefly for a public service announcement. More with our guest, Dr. Irfana Ali, president of the Montgomery County Medical Society. We'll be right back. We're back. My guest this evening is Dr. Irfana Ali, President of the Montgomery County Medical Society. Irfana, when we paused at the break, we were still discussing the pandemic. A few other questions I'd like to cover. One is when patients visit their doctor's office, what can they anticipate? Because I sometimes hear patients are afraid they may contract the infection in a doctor's waiting room. What do you say to that?
So what patients should know is that practices have many different layers of sanitation and safety. They should feel very safe going to their physician's office. Um, many physicians' offices are requiring masking, which I think that they're probably going to see in pretty much all offices. I don't think that there'll be many that don't have that. Um, I would say that they may have questions about COVID-19. Do they have any symptoms? They may want to, uh, you know, triage you in a slightly different way. Perhaps they might want a telemedicine visit with you if you're very sick, or they may offer that to you. They are, of course, having a lot of cleaning procedures. So I just don't think that you should be afraid to go to your doctor's office. I believe that they are prepared and they're ready to um, serve you and to help you with your problems and for you not to worry when you go to your doctor.
Excellent. I've heard stories that some parents are afraid to take their children to pediatrician offices for routine vaccinations, also because they're concerned their children may get ill in the doctor's waiting room. What do you say to that?
Well, gosh, you can't let your child fall behind on their vaccinations. You shouldn't be afraid to go to the pediatrician's office. They are very careful about uh, keeping patients safe. And you should remember that the children have to be vaccinated and that the physicians do want to see them.
My understanding is that many hospitals, including some in Montgomery County, faced with the overload of pandemic patients, have, at least for now, cut back on elective surgeries. Uh, what is the word you're getting about resuming routine procedures in the future?
I believe that as the surge decreases, as hospital beds open up, I believe that hospitals will be able to allow elective surgeries. I think that it's already opened up a little bit. I've been seeing some pre-ops now that we've been doing. So I believe that some hospitals and surgical centers are having some routine surgeries, but yes, they have been curtailed mostly because of staffing shortages and bed shortages. And the bed shortages are mostly because they don't have a nurse for the bed. So it's staffing shortages that's causing this.
Unfortunately, one of the many consequences of this extended pandemic has been the pre-existing opioid crisis has actually worsened given the perpetual stress people are under. What has the Montgomery County Medical Society and the State Medical Society done in collaboration with the state to address this expanding issue?
The county has worked with the state. The task force was created about 5 years ago with MedCai, the Medical Society, and they rolled out a pretty extensive statewide educational initiative for physicians. They had events, they had a lot of CME, they had releases of prescribing guidelines, and screening tools for substance abuse and how to use opioid alternatives. I know that, at least in the conferences that I would, watch or go to, at least in emergency medicine, they were teaching many different, ways to relieve pain that weren't used before the opioid crisis, like massage and, injecting sites with local pain relievers. So the task force was established. And it has relationships with the Governor Hogan's Opioid Operational Command Center, with the Maryland Department of Health, the Board of Physicians, the Maryland Safety Center, the University of Maryland. And also, most importantly, they have, there's a prescription drug monitoring program that does help physicians understand use of opioids. And that's called CRISP. That's the portal that we use. So yeah, I mean, since the start of the pandemic, COVID-19 is impacting substance use significantly.
Where can residents access correct, objective information about COVID-19?
There's a lot of good information out there. The county health department has communicates very updated, very accurate, very timely information about COVID-19 on a daily basis. Their website is montgomerycountymd.gov/COVID-19. That's a really great website to go to. The state of Maryland also has a very robust series of resources. It's available on their website, the coronavirus.maryland.gov. And of course, the CDC is a great website. I go to it all the time myself. So patients can also access it. Just a huge amount of information there.
What are you hearing amongst the medical society physician membership about the challenges and stresses of practicing during this extended pandemic?
Well, certainly there has been, across the nation, there's been what they call the mass resignation, where a lot of people have left their workplaces. Now, have physicians also been impacted by that? Yeah, I think so. Physicians that perhaps were close to retirement age may have decided that this is just the time that they can no longer sustain a practice with the stresses of, the getting supplies, the testing, the vaccinations, and, just stress with the anxiety of what's happening, just like everybody else with the pandemic. So yeah, I think that physicians are also experiencing a similar anxiety as patients are. For instance, one of the biggest things that we all heard on the news initially during the pandemic was the emergency physician that, committed suicide, Dr. Breen. Very
Yes.
sad, but, very, very important call out to understand that physicians are also quite impacted, as well as nurses and everybody working with patients in this very stressful time.
Is it your sense that there's more retirements now than there was pre-pandemic, retirements per year?
I think so. I don't believe I have any specific numbers, but just from patients that we see in urgent care, so many people are coming saying that their doctor retired. So
Yeah.
I'd say that I'm hearing that a bit more than I used to. And just from our physician colleagues, I do know that a lot of people have decided to retire.
Yeah. And certainly it's my sense, speaking to our colleagues, especially those that are full-time hospital employed, that the unrelenting stress has led to depression, and there's already national trends that there may be a uptick in post-traumatic stress syndrome.
Yes.
Yeah.
I can imagine.
Yeah.
I can imagine.
Day after day dealing with that kind of stress.
Yeah, especially in the critical care areas, the ICUs, the emergency departments. Um, I can see pretty much in every aspect of medicine, but especially in those two, I can see where this sort of stress can lead to feelings of just being able to say, I don't want to do this anymore.
Right.
But most physicians are trained to help people, and they push through. And sometimes they push through past what's good for them psychologically, because they know that that's their duty to help patients. So,
Is it your sense that given this growing emotional toil on physicians, the economic challenges, as you alluded to earlier, that it's kind of accelerating the trend towards practice consolidation?
That's an interesting question. I believe that because of the stress of COVID, that there might be more. Yeah, there might be more consolidation because it's just easier to deal with a pandemic or a big event like this as a group than it is solo. So yes, the solo practitioner practice does seem to be decreasing.
Yeah. So that may be, I expect, a permanent change in healthcare locally and nationally.
It might be the case.
Yeah,
It We'll see how physicians do though in those practices, whether they're happy and comfortable doing
sure.
that.
Yeah. Um, Tell us about the National Capital Physicians Foundation. What exactly is that?
So, it's interesting the the whole concept of physician well-being. It kind of transitions into one of the uh, I guess projects that was supported by the National Capital Physicians Foundation. So Montgomery County Medical Society's physician leaders and staff envisioned like an opportunity to be able to have a greater impact on the community. And they recognized that really you needed a structure where there would be educational and a charitable foundation that could take advantage of a lot of the opportunities of grants for public and private grants to support outreach, education, research, and innovation. So in 2016, the National Capital Physicians Foundation was formed, and it was created by physicians for physicians to support causes which kind of help our community um, and contribute to healthy lifestyles and well-being. And one of the most important things, its inaugural project is the Physicians Resources Network, which offers counseling for physicians who are feeling stressed, who may be feeling that they're burnt out. So, but in addition, this coming year, the foundation will take aim at help insurance literacy issues and to support county residents also as they navigate through complicated insurance payment systems. So it's going to expand its scope.
If the viewers have any questions from you as president of the Montgomery County Medical Society, how can they reach you?
Sure. They can call the Montgomery County Medical Society at 301-921-4300. They can also visit us online at montgomerymedicine.org.
Very good. Do you have any closing thoughts before we wrap up the show?
I do hope that patients, who are watching this, try to go see their physicians for their annual visits and keep their health up. Um, you know, being very scared to go to the doctor when you have some underlying diseases that are not being effectively managed may contribute to more illness. And so I think that patients should be encouraged that their physicians are there, they're ready to see them, and that patients should not ignore their annual visits. They should not ignore any symptoms that they're having. If they feel sick or if there is any problem, they should make an appointment with their physician. They should keep their kids vaccinated. If there's a crisis, they should go to the emergency department. The emergency department is very cautious. Hospitals are very cautious. They don't want anybody to get Omicron, because of them, because, they are there to help people. So in closing, I would encourage patients to get medical care when they need it and to feel safe in getting the medical care during this pandemic.
Thank you, Dr. Ali. My
Thank you.
thanks, our pleasure. My thanks to Dr. Ali for an excellent interview. My thanks to my team here at the station for providing this program. And most important, my thanks to you, the viewer, for joining us this evening. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be very interesting. Dr. Tuesday Cook, a well-known bariatric surgeon, in Montgomery County will be discussing the unique challenges of being an African American physician, challenges with patients and her colleagues as well. See you then next time for another edition of Housecall. Good evening.